Children and teenagers currently have a higher coronavirus positivity rate than any other age group here in the state of Florida. During the last week, 1 out of every 4 COVID-19 infections here in the state has been someone younger than 19 years old. Those are the facts, according to data released to us from the governor's office. Dr. Mobeen Rathore, the chief of pediatric infectious disease at Wolfson Children's Hospital, is joining us via Zoom this morning. Good morning. Thanks for being with us.
Good morning.
So I just want to talk facts and science this morning, if we could, Doc. So based on what we saw last year during the pandemic, do masks prevent the spread of the coronavirus?
Jennifer, absolutely. There's no doubt. The vast body of literature suggests that, yes, masks do prevent infections when they are done in conjunction with other mitigating measures such as social distancing, good hand hygiene, good cough etiquette, good ventilation, and good testing and contact tracing. They have to be done as a group. You cannot just take just masks.
So would you explain what it is about the Delta variant that is different from the strain that we saw at the height of the pandemic?
Yes, so Delta variant, just think about this. If the regular coronavirus, if you will, if one person gets infected, they may be able to infect 2 other people. The Delta variant, if one person gets infected, they can infect 8 people. So it's a much more contagious virus. So as a result, in close quarters, such as in schools, the opportunity for the virus to infect more children is much higher with the Delta variant than the previous. This is an equal opportunity infector. So if it finds a susceptible host, it will infect that person.
You work at Wolfson. We know more kids are getting sick because the Delta variant is the predominant strain that is circulating throughout the United States right now. We know that more kids are getting sick than they did at the start of the pandemic. Some of them, in fact, as you know, are in the ICU. Would you describe what the virus is doing to them, how they are sick?
Well, I think the best we know right now, the Delta variant is not more virulent, meaning it does not make individuals sicker. Now, we learn more about it, and that may change. But as far as we know as of today, it's not more virulent. Now, what it is doing is infecting a lot more children. If a lot more children are being infected, proportionately, then a lot more children are getting admitted to the hospital, and a lot more children are sicker and getting into the ICUs. I mean, in July, we had more kids admitted to the hospital than ever before, almost by double the amount that we had previously, that was in January. August seems to be going in the same direction. Today, we have 19 children in the hospital with COVID-19. The peak we reached was 22, and that was the week that CDC reported that there were 203 kids admitted to the hospitals nationwide, and 22 of them were in Jacksonville. So that speaks volumes of what's happening in our community. The admissions to the hospital is just a signal. It's a surrogate marker that there are a lot of other kids in the community who are infected.
Doctor, I would love to continue this conversation for 30 minutes or an hour, even longer, because it's such an important discussion. Unfortunately, we're out of time this morning, but I do hope that you will join us again as we continue to follow the Delta variant and the safety and health of our children within schools. Thank you for your time this morning.
Thank you. Anytime.